Good morning, everyone. We're going to give just a few seconds for everyone to get in, and then we'll get started. Okay. Good morning and welcome to today's Recovery Summit session. This webinar is part of the Recovery Summit series hosted each September by St. Clair County Community Mental Health in recognition of National Recovery Month. A few quick reminders. Today's session is being recorded and will be available on the SCC CMH YouTube channel. Please use the chat for any questions or comments. Our presenters will address them as time allows. For those requesting continued education credits, please be sure to remain on the webinar for the full session and complete the survey that will be emailed to you. We're honored today to be joined by Elise Nichols and Jeremy Berger from the St. Clair County Health Department. Welcome.
Hi, thank you. So today we're going to be discussing the Overdose Fatality Review Initiative here in St. Clair County. As Christy said, my name is Elise Nichols. I'm the Health Education Manager here at the Health Department, and I oversee and coordinate the OFR.
And my name is Jeremy Berger. I'm the data manager for the St. Clair County Health Department, and I kind of just oversee data analysis and collection at the health department.
Yeah, so he's imperative. He's in all of our meetings as well at the OFR and make sure we're on track with data, trending data, make sure we're collecting everything at each meeting that we need to, so we can share this out, this information out to everybody in the public. So I just want to get a sense, if you can plug in the chat, like who's in this virtual room with us, kind of what your role is maybe at your agency. Are you a clinician? Are you a therapist? Are you a school counselor, a social worker? I think that can be kind of helpful as we move through this presentation. We can kind of tailor it a little bit more to you all. Let's just plug in the chat. All right, therapist, social worker, I see coming through. Therapist, case manager. Case manager, okay. And yeah, this is going to be specific to St. Clair County, but I think I see somebody here is from Saginaw as well. It's going to be, I think, an interesting presentation to see how we do it in St. Clair County, because the model of OFR looks different county to county. SUD clinician, okay, great. And I guess if we could just plug in here too, in the chat, do you work with folks on SU who struggle with such substance use disorder as well? Is that one of like your focuses as a clinician, as a social worker? I know you likely interact with all different types of people, but is that your focus? Yes. Okay, we're getting a lot of yeses. Great. All right, so I think we're all in the right presentation then. I think you will all benefit greatly from this. So the objectives of today's presentation is to understand the overdose fatality review process and why it exists, and then also identify key stats related to overdose in St. Clair County and recommendations bred from the process. All right, so I'm just going to kind of give the general statement of what OFR is. So its mission is to prevent drug overdose deaths by examining case-specific underlying circumstances involved, actively seeking feedback from those with lived experience, increasing connections between professionals, serving individuals and families affected by substance use, and providing data-driven recommendations to stakeholders at the community, state, and national level. To, I guess, sum this up, we look at cases on a case-by-case basis every month and look at the person holistically and kind of their life holistically and up to their point of overdose, right? And so we can kind of understand some of the things that were going on in the lead up And hopefully our overall goal is by examining these cases, we can make recommendations to drive the number of overdose deaths down in our community. So that's really why we exist and why this model exists statewide. So some background on the OFR. In 2023, Michigan passed the Overdose Fatality Review Act, authorizing the creation of overdose fatality review teams. So it did exist in different areas prior to that. I think the earliest teams were seen kind of bearing out in 2020, but it was solidified in legislation that they could exist legally in 2023. So it's still a relatively new initiative. And I think probably a lot of people on this call are familiar with Child Death Review, CDR, or maybe even FEMR, Fetal and Infant Mortality Review. So those are reviews that happen within counties, that look at specific populations. And this is another type of review that we can do here countywide. And so I think it's timely. I know there's more conversation now than ever about overdoses and drug use. So having one of these in our community, I think, is really important. Currently, 23 overdose fatality review teams exist in Michigan. Our OFR started in August of 2024, and the St. Clair County Health Department coordinates it. So I coordinate it along with Jeremy. And again, that model can look different from community to community. It just really depends on their setup. I think from the meetings I've attended, it's mostly health departments who coordinate it, but other entities can coordinate it. And it's really about kind of capacity, I think, and expertise. Just of note, no funding allotted for creation and maintenance of teams. So there is no kind of there are no dollars allocated for this. This is something that is done kind of in addition to what we're already doing. And our partners, when they come in, that's something that they're doing in addition to their jobs, whether it be in law enforcement, in mental health, in like treatment recovery.
Alrighty, so this slide here is from Michigan Vital Statistics, and it kind of just gives the last 10 years from 2013 to 2023, the amount of drug-induced deaths in St. Clair County. So you can see we hit our peak here in 2016. We had 74 drug-related deaths. And then throughout the years from 2017 on all the way until 2021, it kind of decreased from there. And we saw a huge drop off in 2022. And then from 2022 to 2023, we saw the numbers jump up back again.
Yeah, so we're watching that 2022 to 2023, we were excited to see that big drop at 40 cases. And so we were really watching the data for 23. It did come back up, but I can't tell you exactly why it dropped in 2022, but we're hoping now that since we have the creation of the OFR team, that we're going to be seeing those numbers drop down as we get more established and more recommendations are put into action.
Alrighty, and this is a snapshot from 2023. It comes from the Michigan Overdose Data to Action Dashboard, or MODA. On the left-hand side, you can see the percent of overdose deaths and the drugs involved. So this is for St. Clair County in 2023. So 24% of all drug deaths in St. Clair County had cocaine in them, 24.1%. 5% had heroin, 35% had other psychostimulants, 61% had polydrugs, and then 72 had synthetic opioids as well. If we look over towards the right-hand side, we can see that huge drop-off from 2021 to 2023, or 2021 to 22. And then in 22 to 23, we see an increase, but we really only see an increase in 3 of the drugs that are listed. The cocaine and heroin use kind of stay flat, and the other 3 categories, the psychostimulants, polydrugs, and synthetic opioids, all see a pretty big increase in usage in 2023.
And something of note too about this data. So certain data sources, it may take time for data to fall into place. So there could be a lag. So the most recent data in some of these databases is a year or 2 old. So just something to keep in mind.
All right, so this is our provisional data from 2024. This data comes from My Celerity. So as of right now, in 2024, there's only been 26 poisoning deaths. So this data isn't fully complete yet, and you will see that for 2025 as well. So this data just takes a while to kind of cycle through the state and down to a local level. It takes years for it to kind of filter in, just because there's a lot of cases in which you have out of county residents dying, out of county residents as well. So it just takes some time for the state to figure out the logistics with that as well.
Yep.
So in 2025, we were at a total of 15 probable poisoning deaths as of right now as well for 2025.
Yep. And we'll keep watching those numbers, and those numbers will be more complete in the coming months. It just takes time, as we talked about, for those to fall into place. We did have a question that came up about data. How much of this do you believe, I think you're referring to that drop off in 2022, how much of this do you believe is affected by the distribution of Narcan and the MORT team? So Narcan certainly, it's hard for me to say exactly what contributed to that drop. Narcan became more easily accessible, certainly in the last couple of years in our community and even statewide, nationally. And I know there's national data that has showed in like 22, 23, there was a big drop in overdose deaths, and that's national trending data. And experts are surmising that easily accessible Narcan was probably one of the components as to why we're able to drive that number down. But I'll just say this, and you all work in the SUD space, anybody who dies of an overdose, it's a tragedy, right? That's something we consider in public health as a preventable death. So we're trying to do our best to drive that number down. So even 40 deaths, I think, is unacceptable. In a community like St. Clair County, we have about 160,000 residents. So just something, food for thought as we keep kind of going through. All right, so let's dive in. So we talked about like these OFR cases. We look at them each month, and we look at one specific person, and I'm just going to give you some information on those cases. So the OFR cases are randomly selected by the coordinator, me, and I just want to emphasize why that's important that it's randomly selected. So I think sometimes there can be a tendency to want to pick a case where we know that there's going to be a lot of information, right? They may have had a lot of interaction with hospital systems, with law enforcement, so we'll have a lot of information. And what we have kind of landed on as a team is if someone didn't have a lot of interaction with services and we don't have a lot of information on them, I think that's just as telling, and we should absolutely be reviewing those cases as well. So like we had talked about, I think in 2023, over 54 overdose deaths. So we're not able to look at everybody, unfortunately, but we're looking at least one per month. So since the team's formation in August 2024, we've done 12 reviews. And then the St. Clair County team chose to meet each month and review one case per month. In June and July, we did have a pause because the health department building moved from like one location to another. So that was a brief pause, but typically we're meeting every month. And each team member must sign a confidentiality agreement before each meeting, and no details about the decedent can be shared outside of the meeting. Only recommendations can be shared. So we can be pretty frank in our discussions and use details about the person when we're in that meeting. All of our meetings are in person. There is no virtual option. Again, that can look different from county to county. That's something that we've chosen here. And I think we've really had some great discussion, and a lot of people seem to appreciate that in-person dynamic of the team meetings. But everything that's discussed in the meeting, all those details of the meeting stay in the meeting. So people in law enforcement are not going back to their office and kind of sharing details of what occurs in the meeting. All that can be shared are the recommendations, and like no identifying information can be kind of derived from that person through the recommendations. Okay, OFR cases. So the St. Clair County Medical Examiner Office has a questionnaire for loved ones of the decedent that they can complete. So I rely on our medical examiner to give me like the death records. And we have a file that we kind of select the cases off of. But once a case or a person is selected, then the medical examiner can go back to that family and say, hey, we have a questionnaire. If you'd be willing to complete, it's completely voluntary. We've had one completed questionnaire so far. It can be a tough thing for a loved one to kind of go through. So we understand why there aren't a lot. Even statewide, the number is pretty low in terms of who submits a questionnaire. But it does provide us with so much information that we might not be able to get from medical records, legal records, law enforcement records about, I mean, the one that we did have, we were able to learn about their childhood, like ACEs in their childhood. We were able to learn some of the family dynamics when they were a child, but also as they age, their work history, things that may have been a little bit harder for us to get our hands on if we didn't have that questionnaire. So it's an option for family members to fill out, but and really an added bonus when we can get it, but something that is a part of our process as OFR. All right, so here is some of the information that's discussed during the meetings: drug use history, comorbidities, major health events, social emotional trauma, ACEs, encounters with law enforcement and criminal justice system, treatment history, and other local factors, missed opportunities to prevent overdose. So anything that's really relevant, we ask those agencies who are part of the meetings to bring that information so we can kind of understand holistically, you know, who this person was, maybe why they're using drugs, the timing of the drug use, frequency, all of that, so that, again, we can drive this number down. So roles and responsibilities: I am the coordinator. I select the cases. I request case information. I schedule the meetings, collect confidentiality and data sharing, and then prepare meeting materials and document any activities since the last meeting. So that's my role, essentially the facilitator. And then the team members, so the people around the table when we're having those meetings, it's up to them to attend the OFR meetings and share details of the case from their agency perspective, and then also discuss potential recommendations or areas of need. So I've kind of pushed our team a little bit, and I think they're receptive and they understand the importance, but they can give me the information ahead of time. But it's really great to have a representative from that agency in the room with us that day, because not only do we have the information from the agency perspective, they're also involved in the recommendation discussion as well. All right, so locally, this is who we have represented on our team, and I'm happy to say it's constantly evolving. And as we go through more cases, someone will say, oh, well, Elise, what if we have this person? I think this person would be really great to have, or that, you know, agency. And so we've been building our network slowly but surely. We have all county hospitals represented, of course, the health department. And when I say the health department, yes, me as the coordinator and data, well, Jeremy for our data perspective, but we also have a harm reduction program here at the health department. So we have a rep who can kind of talk about needle exchange and also their interactions if they had any kind of communicable disease as well. CMH is involved, the medical examiner, Tri-Hospital EMS, Professional Counseling Center, BW Rock, Recovery Agency, Odyssey House. Odyssey House also has the MORT, the Mobile Overdose Response Team in our county, Crossroads Recovery, Veterans Affairs. I just want to take a quick note of Veterans Affairs. We did have a case where there was like a veteran connection, and we might not have, you know, records, unfortunately, if they go to our local hospitals, if they don't go to our local hospitals. So VA has their own kind of medical system and network. So having somebody from the VA, we realized pretty early on was critical. SEC Probation Parole, SEC Intervention Center, SEC Juvenile Services. Another one I want to kind of spend a minute to talk about, and this is unique to St. Clair County. We have a drug task force that's through the sheriff's office. And so we are St. Clair County on an international border with Canada. So we do see, and you probably have seen the news articles of drugs, being transported illegally back and forth. And so we have a drug task force, which is special to our community, and those cover all the municipalities within the county. So we don't necessarily need to have Port Huron Police, Marysville Police, like all of these individual agencies. We have one rep who can get all that information and really speak to that information throughout the whole county. CPS, and then Blue Water Safe Horizons, which is a domestic violence shelter in our community. So I just want to pause. Anybody have any questions? We're moving through here pretty quickly. I see a couple comments. We have a comment. I just read the Times Herald article on study finds most drug treatment in St. Clair County concentrated in just 5 blocks. It reports a significant disparity for county residents outside of Port Huron to get treatment. Yes, thank you for that. We're going to take questions as we can throughout. There was a study recently done through Michigan State University. I think it just came out this week. And it was done in partnership with some local agencies. And it did find that there was a concentration of services in Port Huron kind of proper. And people in the outlying areas kind of reported issues with access to service, and also a higher likelihood of overdose in those outlying areas. And so, yes, that is something that is data we're looking at. And I think even more pressing, right, why we do those random selection of cases. And I'll just note as well, here at the St. Clair County Health Department, we have a community health improvement plan, and we facilitate it, but it's a community plan. And one of the priority areas, so it's a 5-year plan, there's 3 priority areas that were selected. It's mental health, substance use, and obesity. So our community told us substance use is a problem that we need to address in terms of our health. So that's something that we're looking at countywide and looking for solutions at as well. So thanks for that comment. Someone else said, as well as the inability to find MAT services such as Vivitrol within community other than for clients CMH. Yes, absolutely. So identifying these gaps is something that we're looking at during the reviews. And in the couple slides, I'll show you what some of the recommendations have been, but absolutely that's something we're looking at. So thanks for the comment. Communication channels. So the Overdose Fatality Review Team, we look at the cases individually and we provide the recommendations. Then those recommendations are given to our community action team, who put them into action and implement them. So our community action team here locally is, it's called the CSCB. It's a community collaborative, and they have a work group that focuses specifically on SUD. So I sit on that as well. And we try to kind of put those recommendations to action. So there are 2 separate groups who make up the OFR. All right, I just want to give you a sense of what a review looks like. So we're going to do a mock review. The first slide is typically just, St. Clair, and I put the number. So, if we're doing 12 in any given year, you'll see where we're at. Like if it's June, it'll be like St. Clair County 6, right? In terms of our case number. And then I plug in the obituary. So sometimes there isn't an obit for someone who's passed. Other times there is, and when I can get an obituary, I'll plug it in and I'll read it. So, you can see this one, it tells the person's age, date of birth, when they passed away, their surviving family, if there was any kind of employment, and some of their hobbies. So it is, I think, important to include that obituary because it really brings it to the personal. This person, was a person, had a life, had a family, and I think it's just kind of a means of respect to look at that and start off with that. Then we look at demographics. So sex, race, education, age, marital status, employment status, usual occupation, veteran status. So this is a standard template I have. And sometimes when we go into the meeting, I don't know all this information that might come through the course of our discussion and our meeting with other agency partners. So I kind of fill in as we need, and I rely heavily on Jeremy to kind of plug in kind of the holes as we have our discussion. So circumstances of death, I have in there cause of death, manner of death, date, time of incident, zip code of incident, date of death, and then zip code of death. So sometimes the incident could occur, for example, like in the home of the decedent in an outlying area, and then they're brought to Port Huron in one of our hospital systems, and then they pass there. So that's why we have some different stats that we look at in terms of that. Oops. All right, and then this is a slide I put up, and we have a round table. And so it's just kind of a reminder of the things that we're looking at to share. And then we go around in the kind of a round robin style, and everybody shares out what they have, what information they have about the person who had passed. And then I create a timeline. So this is obviously, this is a mock, this is not a real case, but I outline a timeline. I typically just do it right on the whiteboard because we're getting all this information during the meeting. So Jeremy is a big help in helping me get all the details together. Not every detail is included in the timeline, but some poignant life moments I'll put up there so we can kind of see, I guess, visually the person's life. And so oftentimes the first thing that we have on the timeline is like a law enforcement interaction or like a CPS interaction that they had as a child. And then you can kind of see into adulthood. Of course, I'll plug in anytime if they had any previous overdoses, that'll be plugged in. Significant medical encounters, law enforcement interactions, interactions with like mental health providers if we have that information. And then, in the top corner, we'll also put things that we don't know exactly where they fall in the timeline, but we know, okay, has been divorced twice. Maybe they lost custody of their child, that kind of thing, because that could really inform, I think, some of the actions of somebody too that we're examining the case for. All right, recommendations. So then at this point, I'll ask for recommendations from the group. And these are the questions I'll ask. Does the team have enough information to proceed with the review? What lingering questions do you have? Was there any trauma present? What risk factors were involved in this death? Could this death have been prevented? And what do we recommend should be done to prevent other similar deaths? And should we recommend any changes to agency practices or policies based on what we know about circumstances, cause, and manner of death? And I just want to make clear, when we're going through these reviews, oftentimes, just like child death review and FEMR, these other reviews, it is not to place blame on the person who has passed. It is not to place blame on a specific agency or any person. It's really to look at systematic gaps and how we can, remove those and make things better for our community. So that is really the intent behind this. So in these meetings, I'm never looking at somebody in the room like, wow, that I didn't really like how that happened, or that interaction didn't seem great with that person. that's not the point of this. It's to look at gaps in the system and address them. And some are low-hanging fruit, like things that we can do pretty easily and implement, and others are big that might need some legislation behind it, and some coordination, not only community-wide, but at the state and national level. All right, so that's the end of our mock review. Our meetings typically, well, they're scheduled for about an hour and a half, but they've been going a little bit longer because there's been a lot of discussion, which is wonderful. And I just want to give you all some sense of some deeper demographic information on the cases we reviewed. Again, we've only done 12 thus far, only 12. It's a good number, but the more data that we have, the better. So this is what's kind of been bore out of the data. So 83% had one or more children, 50% had a diagnosed medical condition, 50% had a diagnosed mental health disorder, 50% tried to stop using drugs in the past, 42% overdosed in the past, 42% interacted with the criminal justice system as a child, and I'm going to touch on that a little bit more in following slides. 92% interacted with criminal justice system as an adult. 75% interacted with criminal justice system due to drug use, and 67% interacted with criminal justice system within 1 year of death. So I think some key statistics and things that we're following. And again, when it comes to these metrics, I want to make clear, this is things that we know for certain. So when we're filling these things out, it's yes, no, unknown. These were all yeses. So some of these numbers is just unknown. So they may have had, a diagnosed medical condition. We just don't know. They may have had a diagnosed mental health disorder. We don't know. That 50% is what we know for sure because we have the record. So just some food for thought. Now let's dive into the recommendations. I think probably this is what we've all been waiting for. When we do our reviews, we typically have 2 to 3 recommendations per review. And so at the end of last year, and we're going to be doing it again at the end of this year, we look at all of the recommendations in total and prioritize them. So this was the priority that we had in 2024. And I'm just going to read them off here. Reestablish more team relationship with ERs in the hospital systems, and then also have regular training for ER staff on MORT. So one of the things that we found is there was some changeover in staffing with the MORT team. And that's the mobile overdose response team. And there was also some turnover and changes in staffing at our local hospitals. So to make sure that that relationship was solid and reestablished, but then also have that regular training, because we realize, this is the way of the world. We see staff come and go, and we want to make sure that everybody understands the resources that MORT has to offer. The second one was install a peer recovery coach on site at all county ERs, or increase connection with BW Rock, which is a recovery agency, and other treatment/recovery agencies. So again, having that on-site or easy connection for our local hospitals to make referrals to folks who specialize in SUD and can be there quickly was something that we have found, as a recurring recommendation. Third one is add fentanyl testing to all urinary drug screens in the ERs of county hospitals. So not all hospitals do that. It is not a standard. So that is something that we are looking at as a OFR, as a recommendation. And then fourth, have centralized database for various St. Clair County agencies to review or enter information about encounters with people struggling with opioid misuse. This is going to, this is a little bit meatier, I think, of a recommendation, and something that would need to take lots of coordination, especially when you're dealing with HIPAA data. So something that we're looking into and we've passed along to our state partners, because this would this would be more involved and would need definitely some approvals, not only from corporate, from specific entities, but probably from the legislature as well. Case recommendations continued. So these were the ones that have really been have risen to the top, I think, in the last 6-ish months. And I'll just read those off. Educate community on how/when to use Narcan, including with family, friends of someone using opioids. So I just want to explain some of these recommendations. What we found within some of these cases is that people had access to Narcan, right? The person using drugs had access, but if they're the ones who are going to be overdosing, it's kind of a moot point, right? to have the Narcan because you need someone else to administer. So educating the people around them is incredibly important so that they feel comfortable using the Narcan and that they can identify the signs and symptoms of an overdose. So that is something we're actively working on. And that had been an initiative prior to the OFR, but something that we're certainly, now that we have these recommendations under our belt, can be more pointed and targeted with. We did have another comment come through. BWROC does not have licensed and trained clinicians, nor do they offer intensive program. Yep, that's true. They're a recovery agency. Someone else said, how about an overdose hotline? I've seen it work here in Macomb County. Yeah, there are different models. There are certainly different models. These are recommendations. And so beyond the recommendations, we're going to have to find strategies to implement them. And that's what our community action team is working on right now. Alvin is on a basic otter plan. Okay. So the next recommendation is improve mental health supports for people with substance use disorder and their loved ones. Again, something we saw recurring over and over again is that, there is access, but, maybe taking advantage of those mental health supports, making it as barrier-free as possible. I think we're all trying to get better. And then, in addition, the people around them. And that's a recurring theme, I think, at least for this year's recommendation. And it's not only the people who are struggling with substances, but the people around them, the loved ones around them. Because I think there's a lot of struggle as well. It's not, I just think, we know there's a lot of struggle amongst those family members and friends of people who are struggling with substance use. And so how do we support them as well? And the last one, and I put it in italicized because it is come up over and over and over again, is educate public on adverse childhood experiences, ACEs, as many of the reviewed cases have childhood trauma. Many decedents also have children themselves. And so this has, I guess, two components to it. As we're reviewing these cases, nearly all of them, the people who have passed, have had ACEs, right? They've had some kind of childhood trauma, and which, we can surmise probably informed maybe their substance use and other choices that they made as they aged. But what we're also seeing is, and this kind of bears in line with what we're seeing nationally in terms of data. So nationally, a report just came out that nearly a third of people who use drugs or have overdosed have children. And so a huge majority, I think we had that in a slide previous, a majority of the folks that we're reviewing also have children. So what happens when that parent, passes on and the children are left? Like, how can we wrap our arms around them as a community and support them and break the cycle of not only poverty, but of substance use and some of these other, adverse health outcomes as they age? I don't have, the answer for that, but right now our OFR team has said education is key and that early intervention is key. And so we're still thinking through strategies of how we can better address this. There's a couple more comments. Family coaching is a great idea. do you know the info for this hotline? If someone can drop that in the chat. Using alone, call us. So someone else had put the information in there. There are systems that exist where if you know you're going to be using drugs, you can call a hotline and have them on the line with you as you're, again, that does not exist in our community, but you can call them and they'll stay on the line with you. And if you don't continue talking, then they're going to call an ambulance for you. So there are different things that exist in different communities. That is not something that exists in St. Clair County. All right, and we've had some success already. We're still very new, but we've already had some successes. We established our MORT team relationship with ERs in the local hospitals, so that did happen, and we're really excited to see that contract, a partnership between local hospital and VW Rock for peer recovery support. Several community partners give Narcan away and provide education on use. These include pharmacists, health department, recovery treatment agencies such as VW Rock and Odyssey House. So again, not only having those Narcan boxes available, but that education piece in addition. So, you ideally want to be prepared to use it if you have to use it in that setting, because time is of the essence if someone is experiencing an overdose. And again, these are not all of the recommendations that we have acquired throughout these 12 reviews, but these are some successes. And at the end here, work has started or continued on several other recommendations generated from the meeting. So we're doing some advertising. This is the recovery month. So and a big awareness month for folks who use substance use. So there's been some coordinated advertising and language that several agencies have used. All right, I just want to look at some of these chats. I think it's helpful to do this in real time. Do you have any data on accidental overdose incidents? Is becoming more common for individuals to obtain a substance that has opioids, which they were not aware of. I don't have data on that specifically right now, but you're right. And that's something that we do educate on. And I'm out in the community quite a bit too, and people often say to me, and I'm sure you might have had the same experience, is that, well, I don't need to worry about that. Nobody I know uses opioids. I think they're thinking, illegal street drugs, but grandma could certainly be prescribed an opioid. Someone who just had surgery could certainly be prescribed an opioid. And it's important for us, to know that they're educated, that they have access to Narcan. And so I don't have data on that specifically, but maybe Jeremy, do you have any data? We can look into it.
Yeah, we'd look into it.
But that education piece is, it's not just this illicit drug use. Anybody and everybody, could hypothetically have Narcan, and because you never know when you might need to use it. It could be in various situations that it could be used. They stay on the phone with you while you use, and call 911 if you become unresponsive. Okay, thank you. All right, general successes. So this is aside from the recommendations. Like I said, we have our community action team, CAT for short, and they realized there's a lot of recommendations coming out of this OFR. They're meeting monthly, and we want to be more responsive. So they broke off and have a subcommittee that's working specifically on OFR recommendations. I think that's a credit to our community and realizing the importance of the OFR and really putting people's time and energy behind those recommendations. So kudos to the CAT team. That was not something I had asked for or that we were pushing for. That was something that happened organically. Second thing, strong participation and buy-in for OFR process from key partners. So again, participation in the OFR can look different from county to county, from OFR group to OFR group. And we have had very strong participation from the start. And we've just added members as the months have gone on. And I just want to give a special shout out to law enforcement. We were recognized last month during a state meeting because we have strong law enforcement participation, and that can be difficult for some OFR groups to get law enforcement there for whatever reason, right? And so our law enforcement people, I can say, have been at every single meeting without fail. And then the last thing, there's a new data tracking system introduced by state partners at Michigan Public Health Institute. So MPHI is our state partner who helps oversee all the OFRs and make sure that we're on track, we're hitting all of our marks, we're fulfilling everything that was written in the legislation for an OFR to exist. So they have a new data tracking system that literally they just rolled out last week with us. So we'll be able to populate more data. And as we move through more reviews, I think we'll be able to see more trends as well. And I'm excited, hopefully next year, we can do another share out on this platform and can tell you, the things that happened within the last couple months of 2025 and then the year of 2026. All right.
All righty, we'll take a look at our community resources. So for harm reduction, we have our harm reduction program at the St. Clair County Health Department. This program's been pretty critical because it helps meet these individuals like where they're at that point of time. Not everyone's ready for treatment like right away or for advice or for resources. So with that program, they kind of take it at their own pace. They also help give out the needle exchange program. They also offer HIV testing, Hep C testing, and offer vaccines as well. And we also have the Narcan boxes throughout the community. I think at this point in time, we've got one at every single library and every single municipal building as well. For mental health resources in the community, we have our St. Clair Community Mental Health, our Professional Counseling Center, or PCC, our Catholic Charities of Eastern Michigan. For treatment and recovery, we have our secclink.org. What that is an online referral system. It's kind of like a warm handoff. So either a person who's struggling with substance use or like either a family member or a friend can help fill out this questionnaire. And then based on those questions, those answers are either going to get sent to someone maybe at the health department in the outreach program, or even some individuals at BW Rock or Odyssey House as well can receive those referrals. And there's also an option just to receive some information and additional resources in the county through that link as well. For the other recovery and treatment options, we have our BW Rock, or Blue Water Outreach and Recovery Center, Odyssey House, Crossroads Recovery Community, our Region 10, St. Clair Community Mental Health again, and then Catholic Charities of Eastern Michigan as well.
All right. And I see some people in the chat. Odyssey House also offers harm reduction. We hand out bags we get from the health department, so another partner. And then SHPH provides Narcan. So some other resources too that aren't listed if people are looking for resources. Do you want to? I guess I can do this side. So I'm Elise again, and this is Jeremy. This is our contact information. So if there is like data, or if you are interested in learning more about it or want a presentation at your agency, please feel free to reach out. We can do so. But we have some time for questions. So if anybody has any questions, we have, I think, like 7 minutes.
I will say, going back to that one question about the accidental overdose, I think even a few of our cases already haven't been necessarily your typical people that are abusing drugs per se. So I think there's already been some data showing, one or two of those have definitely been accidental. They don't really know what they're taking, or, we've had cases where people aren't technically like ODing, it is just all accidental. So
Mhm.
it is something we could look into more for sure.
Yeah, they're risk categorized as overdose deaths, but breaking that data further. Christy, any questions on your end? I can zoom out so we can see everybody.
No, I think you guys covered all the questions that I've seen also come through.
Okay. Well, thank you for the information and hard work to make changes in St. Clair County. Thank you. I think, we want to give kudos to Liz King, our health officer director, and Ken Hoovelman. There are a lot of community partners who, Amy Smith from Community Mental Health, who wanted to see an OFR in our community. And it's really about capacity and availability, right, to get this thing done. And so Liz said, the health department can do it. We'll start it up. And it's been really interesting to go through the cases, I think, and see the details of people's lives, and then kind of look at it, on a small scale from an individual, and then see what are we seeing over and over again. But it really puts a face to the name, right? It really humanizes people. They're not just a statistic, and it's hyper local, right? And as we talked about, some of that data is lagging. So we're getting some more real-time data as we do these reviews too, and can kind of see, okay, what drugs are people using and overdosing on? What are some other circumstances that might be contributing to a death that are more timely that we can address? Okay, Ken Hoovelman is amazing. Yeah, he's great. A great advocate for, substance use resources in our community. Any other questions?
Seeing anything?
For folks to get their CMEs, does it need to be 55 minutes? Or what was the time?
Yeah, it should be at the absolute least is 50. So
Okay.
we usually try to shoot for at least 55, but it'll be good.
Okay. Okay.
All right. I want to just thank you both for sharing your time and information with us today. A lot of really good information and resources. So we appreciate that. I also want to thank everyone that attended the session today. We hope you found the information valuable. Today's presentation is just one of many webinars being offered throughout September as part of the Recovery Summit. For details and registration for upcoming sessions, please visit our website at www.sccmh.org under the Events tab. Also, please keep an eye out for a short survey in your email. Your input is vital in helping us continue to improve and shape future events. For those requesting McBAP and peer certificates, they will be emailed out in mid-October. If you're requesting social work CEs, your certificates will be emailed to you after payment is received, if applicable. Thanks again for joining us today. Thank you both again for being with us. We look forward to seeing you all at our next session.
Thank you.